Bones of the skull. Bones of the skull are divided into two groups. 1. Bones of cranium. 2. Bones of face. Bones of cranium. Cranium is formed by 8 bones. They are 1. 1 frontal bone. 2. 2 parietal bones. 3. 2 temporal bones. 4. 1 occipital bone. 5. 1 sphenoid bone. 6. 1 ethmoid bone. Sutures of cranium. The immovable joints which unite the bones of the skull. Coronal suture. Between the frontal bone and the 2 parietal bones. Sagittal suture. Between the 2 parietal bones. Lambdoid suture. Between the occipital bone and the 2 parietal bones. Frontal bone, it forms the forehead and the roof of the orbit. Supraorbital margins form the arches of orbit. Nasal notch. Bone projecting between supraorbital margins. Superciliary arch. Lies above these 2 structures. Frontal tuberosities, the 2 prominences of forehead. Frontal sinus, a space behind the forehead. It contains air and is lined by mucous membrane. Parietal bones. They are 2 in number. Both form the roof and sides of the skull. It has 4 borders, for angles, and 2 surfaces. The articulation of this bone are anteriorly with frontal bone, posteriorly with occipital bone, medially with the other parietal bone, below with the temporal bone. It contains an eminence called parietal tuberosity. Superior and inferior temporal lines are the 2 lines which run parallel to each other. The inner surface is concave. It has impressions for meningeal vessels. Temporal bones. They are 2 in number. They form lower part of the sides of the skull. The parts of temporal bone are squamous part, a flat part having the zygomatic process which is connected to zygomatic bone. Petrous part forms the bone of internal ear. Mastoid part contains mastoid process. Tympanic part contains the external auditory meatus. Occipital bone. It is at the back and lower part of the cranial cavity. A prominence above called as external occipital protuberance. Condyles, 2 in number which articulate with atlas. An opening at the base of skull called foramen magnum. Sphenoid bone. It lies at the base of the skull. It forms a large part of middle cranial fossa. 2 pairs of wing-like structures called greater and lesser wings. Sella turcica or hypophyseal fossa, which is a fossa for the pituitary gland. Ethmoid bone. It is cubical in shape. It is very light and thin. It is situated at the roof of nose and in between the orbits. 2 labyrinths composed of ethmoidal sinuses. A perpendicular plate forming the upper part of nasal septum. Cribriform plate fitting into a notch of frontal bone. Cranial fossae. The base of the skull is divided into 3 fossae. Anterior cranial fossa. It is formed by horizontal plates of frontal bone. Middle cranial fossa. Formed by sphenoid bone and petrous portion of temporal bones. Posterior cranial fossa. Formed mainly by the occipital bone. The fontanelles. Skull bones of the child are not completely ossified. The space between the bones are filled by membranes. These membranes at the angles of bones are called fontanelles. Anterior fontanelle. It is the largest of the fontanelles. It is diamond-shaped. It is situated at the junction of frontal and 2 parietal bones. Posterior fontanelle. It is at the back. It occurs at the junction of 2 parietal and the occipital bones. Sinuses of the skull. These are cavities or chambers present in the bones of the skull. Frontal sinus. They are 2 in number present in the frontal bones. They are present on each side at the root of the nose. Maxillary sinuses. 2 in number, present in the maxillary bones. They lie on each side of the nose. Ethmoidal and sphenoidal sinuses. They are the other sinuses present in the skull. Functions of sinus. They give resonance to the voice. They lighten the bones of face and cranium.